Welcome to Competitive Sleeper.
Thank you for coming by on such short notice. I need to practice for my nursing exam, and I was wondering if I could perform something called a cranial nerve exam on you. Is that okay? Okay, cool. So what I'm going to do is we're just going to pretend like we're in a doctor's office and you just came in, and I'm going to ask you several questions, and then I'm going to perform the exam on you. Okay? Okay. So let's pretend you just walked in, and the first questions I would ask you would be, so for example, let's say you were coming in because you were having some dizziness. So I would say, do you have any other conditions I should know about? Diabetes, any thyroid conditions, even allergies? You can tell me the truth. Okay. 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 Great. And when was the last time that you saw a doctor about this? Okay. That's okay. It's nothing to worry about. It's very normal. Okay. Are you currently taking any medications? Okay. Okay. How are your sleeping patterns? Okay. And do you drink alcohol, and how often? How often? Okay. And do you drink coffee, and how often? Okay. Like how many cups a day? Okay. Okay, and do you smoke? Everything? Anything? Okay. And how often? Okay. And when did you first start experiencing your symptoms? And are you experiencing them right now? Okay. So I'm going to go ahead and perform the exam on you. So there's several different portions of the exam. The first is called the optic or the ocular motor, and that's where I'm going to test different movement patterns of your eyes and your peripheral vision. I'm also going to test your olfactory nerve, so I'm going to have you smell a couple of things. Don't worry, they're all pretty pleasant smelling. And then I'm going to test your trigeminal nerve, which is testing the reactions to light touch. So I'm going to touch your face in places and have it to see if you react to hot or cold, and to test the basic reflexes of the muscles in your face. Then I'm also going to test the facial nerve, which is the motor skills of your face, so like your facial expressions and I guess other muscular movements of your face. And then we're going to do the really big kahuna, and it's called the vestibulocochlear nerve, which is actually a really fancy word for just the hearing test. So I'm going to whisper a couple of things in your ears, and you're going to have to recall that information for me. Then after that, we're going to do the accessory nerve, which is I'm going to test how your head moves on a swivel and how your shoulders move. And that's the end of the test. It's actually pretty fun, and it's going to be done relatively quickly. So first, let's start with I have to do a check on you. Is it okay if I touch your neck and your head? Okay. So I'm just feeling out your neck. Have you had any sudden weight loss or weight gain? Okay. I'm going to feel your head. And in the shower, when you wash your hair, have you felt any abnormalities in your head? Have you felt any bumps come and go behind your ears? Yeah, actually there's a gland right behind your ear, And sometimes, for me anyway, when I have really terrible allergies, they'll get inflamed and they turn into little lumps right behind your ears, and then they go away. So that's why I asked you that. So it looks like I didn't feel any bumps on you. I didn't feel any abnormalities in your head. So that's looking pretty good. So now I want to ask you a few questions. So can you see my entire face? Okay, we're going to do a color test. And I'm going to point at each color with the pencil, and I want you to tell me what color it is. Okay? Good. 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 Okay, you're not colorblind. That's good. All right, now I'm going to check your peripheral vision. So I want you to just look straight into my eyes, and I'm going to hold out my fingers right to the sides. And don't look at my fingers, just look at my eyes. I want you to tell me which side, left or right, is moving. And I want you to just say left or right. Are you ready? Okay. Good. I tricked you. Very good. All right, you're looking pretty good. All right, so now we're going to check your eyes separately. So I need you to cover your left eye, please, like this. And now we're going to do the same exact thing. So I want you to look directly into my eyes and hold up my fingers. And I want you to tell me which ones are moving or wiggling. Okay? I'm trying to trick you. Good. Very good. Okay, now the next eye. Same thing. Ready? Look directly into my eyes. Good. Very good. Good. Great. You did a wonderful job. All right, so now we're going to do something called the accommodation reflex, and this might be a little bit uncomfortable, but I want you to just at least try it, okay? So no longer, or don't look into my eyes any longer. I want you to just look at my finger, and I'm going to push it, or make it come as close to your face as possible, and I want you to try to look at the finger as long as possible. So I'm pretty much making you cross your eyes. Okay, ready? Here we go. Keep going. Keep going, keep going, and good. Most people can't get it in that far, but they try. So there's that, and then we want to check the movement of objects. So what you want to do, or what I'm going to do, is I'm going to hold up this pencil eraser, and I'm just going to drag it from all different directions, and I want you to track it with your eyes. So I want to see the movement of your eyes to see if there's any irregularities or to see if there's a fluid motion. Okay, so just look at the white eraser. Very good. Very good. Okay. See, this is fun. Okay, so the next test will be the pupil dilation test. So I'm going to hold up a flashlight into your eyes, and I'm going to look at your pupils and make sure that there's symmetry and make sure there are no abnormalities in your pupils. But I tell you, just look at the tip of my nose. Do not look into the flashlight or you will be sorry. Okay? So I need you to just look at the tip of my nose and just checking your eyes for any abnormalities, and they look pretty good. Okay, so I want you to do something for me. I want you to cover your left eye like that. Now uncover it. Good. All right, the next eye, same thing. And uncover. Very good. so you're looking pretty good. And I'm just writing in here that everything seems to be normal, and kind of wish that you did have some abnormalities, so I'd actually have something to say. Okay, so I want you to, without moving your head, I want you to take your eyes, and I want you to look as far left as possible. So, look as far left as you can, and hold it. Good. Now I want you to do the same thing, just look right, and as far right as you can, and hold it. Very good, and you may relax. See? This isn't so hard. Okay, so everything looks like it's in great shape. So now we're going to do the fun one. We're going to do the olfactory. So I'm going to hold up some different scents for you, and you can either guess what they are, or you can tell me whether it's a bad smell or a good smell. You want to try to guess what they are? Okay. So I'm just going to hold these under your nostrils. And first, the first smells, I'm going to have you smell with both nostrils open, but for the additional smells, I'm going to have you shut your left nostril and your right nostril just to test each nostril to make sure that they're both unobstructed. Okay, ready? So here is the first smell. Can you guess what it is? Very good. All right, and the next smell? This one's hard. Can you guess what it is? Nope. I'll never tell. All right, so this last smell, I want you to try to guess what it is. That's a really good guess, actually. It's actually watermelon, but I always get strawberry and watermelon mixed up. All right, so for these next smells, I want you to to close your left nostril. So for you, it would be this nostril. Ready? And smell, please. Okay. What do you think it smelled like? Very good, cotton candy. All right. And I want you to close your opposite nostril. I'm going to hold up an additional smell. I know it's hard. You want to try it again? Here. That's very good. It's cinnamon gum. Don't ask me how I got it on that Q-tip. Okay. So, that was it for that. So now we're going to do the hearing test. And the hearing test is very easy. I just want you to cover each ear, whatever ear I tell you to, and you're going to listen to the different numbers that I'm going to whisper into your ears, and then you're going to recall them back to me. Okay? It's kind of like a memory game. All right, so I want you to cover your left ear, which is going to be this ear for you. All right, so I'm going to whisper some things in your ear. 7, 8, 11, 12, 16, 2. Can you remember them all? Very good. See, it's kind of like a memory test as well. All right, so I want you to cover the next ear. And I'm going to whisper some more things into your ear. You'll have to recall them. Are you ready? Okay. 1, 2, 17, 91, 92, infinity. Go ahead. All right, you're very good at this. All right, so we are going to do this one. It's going to feel quite nice. It's the trigeminal nerve test. So I'm going to take some Q-tips and I'm going to rub them on your face. And I want you to tell me when exactly the Q-tip is hitting your face or touching your skin. Okay? Can I do that? Okay, great. Here we go. Ready? Again. Ready? Okay. And last time. Nice. Beautiful job. Alright, so this test is very similar, but this spoon has been in the freezer, so it's very cold. So I want you to tell me when it is touching your face. I know it's kind of scary, but it actually feels really good. It's pretty hot today. Alright, are you ready? And this time I want you to close your eyes. So go ahead, close your eyes. Okay. And just say when it touches your face. Good. 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 Try to trick you. Good. See, it feels kind of nice. Doing a great job. Alright, so this is the motor skills test. So all I want you to do is just perform the facial expression that I tell you to. So can you give me a great big smile? Smile, smile, smile. Big, big, big. Very good. Now I want you to frown. Frown, frown, frown. Push out that lip. Very good. Now I want you to squint your eyes and close them as tightly as you can, like this. Very good. And I want you to open your eyes as wide as you can. Try to raise your eyebrows. Very good. Okay. See, that wasn't so hard. Alright, so this one is kind of strange. It's called the jaw reflex test, and I'm just going to use my 2 fingers. I'm going to place one of my fingers on your chin, and I'm just going to tap these 2 fingers, and your jaw is just going to move slightly. If you were to have some sort of condition where you had like a lockjaw, or you were grinding your teeth at night and you had just sore jaws, or this muscle was overworked, it would be tough for me to move it with just this movement. But we'll see how tight your jaw is. Ready? Perfect. It's great. You don't grind your teeth at night? You haven't had any headaches or anything? That's great. Okay, so the last part of the test is the accessory nerve, and so this one is where I'm going to test how your head swivels, and I'm going to test how your shoulders move. So let's do the shoulders one first. So I have my hands on your shoulders. Now I want you to lift up your left shoulder. Good. Now I want you to lift your right shoulder. Good. Now I want you to lift them both at the same time. Very good. Okay, so now, what was the next one? Oh yeah, the head one. So I'm going to hold up my hand to your face like this. And I want you to push your face against my hand and try to push against the resistance. And I'm just testing to see how hard you can push back. Well, not how hard, but how reactive that nerve is. So why don't you go ahead and push against my hand, please? Very good. And push against my hand, please. Okay, and I'm just going to put it under your chin like this. And I just want you to push down. Alright, very good. Okay, so overall notes. You're extremely healthy, due to this test, or what this test is telling you. And all of the nerves in your cranium are working very well. And I didn't see any abnormalities. And you seem to be fit as a fit. Okay, and that's it. Thank you so much for your help today. Okay, I hope I see you later.